picture. I'm not a genetic counselor, but I couldn't resist that picture, so it was just taken. Thank you very much for that talk, which even I understood, and I think that hopefully everybody understood the basic mechanisms of how genes are transferred and what the different recommendations are for the different forms of polyposis. And now we are going to talk about a very, what we consider, all of us consider a very important topic. And that is the, as you can see from the slide, the psychosocial aspects of familial polyposis and polyposis syndromes. And we are fortunate to have in our group someone who's relatively new over the past few years, Dr. Tay Hart. And her research centers on psychological factors associated with adjustments to illness in chronically ill individuals and their spouses and partners. She has investigated quality of life, psychological distress, and symptom burden, and how patients and families handle this. And now she's actually expanded her research to examine the psychological impact of having hereditary polyps and cancer. So a very important part of what we do and what we think is important in disseminating this kind of knowledge and doing this kind of research in our research center. And I would like to introduce Tay, who comes here from San Francisco. He's a professor at Ryerson Institute, but really, I think, really enjoys working with us more than at Ryerson. She's told me that at least, and we're very happy to have her. So Tay, please come to the podium.
I'm glad my other boss didn't hear that. So my talk is split into two components, I would say. The first component is going to look at, many of you are adults in the audience who have been diagnosed with FAP or have relatives that are adults with FAP. So I'm going to speak about that. And then as I was putting together this talk, the genetic counselors asked that I speak to the issues of younger children. So if you're a parent of somebody that's under the age of 18 or 14, and I've also got a little bit of information about how to talk to your children about FAP. So these are typical challenges when you look at the research literature that I think affect both whether you're a very young person, somebody that's 10 or 12, versus somebody that's 35. Almost everybody with FAP has to live with various challenges. So of course, one of the most frequent challenges is, yearly screening for cancer that everybody has to go through. And almost everybody will be faced at some point about decisions about surgery, what kind of surgery to get. So for those of you who have had surgery, you already know that typically Zane will be talking more about this, but the two typical surgeries are IRAs, which is an ileorectal anastomosis, or an ileopouch anal anastomosis, or an IPAA. So decisions about what kind of surgery people are going to get, and then adjusting to the surgery. And each of these surgeries carries a different side effect profile. Almost everybody has thoughts around whether or not to have children. Most people do end up having children, but almost everybody does struggle with the idea of passing down the risk of FAP to the kids that they do have. And then, of course, their own worries about developing cancer. Will I develop cancer? Living with the uncertainty of kind of cancer looming out there. And that's not just for oneself, but also for one's family members, one's affected relatives. And looking at, if you're somebody who's new to the diagnosis or new in the process, looking at your relatives who have either had good experiences versus bad experiences is going to color your own kind of expectations. And I would say the final thing that kind of is a theme is that A lot of people are the only person in their family practice that has FAP, or their family is the only family with FAP in their family practice. And I see people nodding about that. And struggling with other healthcare providers, lack of experience with FAP, and then you having to be the sole educator of your own doctor can be difficult for people. So those are some of the common challenges that we see across studies. But in terms of the specific impact of FAP, you know, it doesn't come as any surprise that people across study to study to study talk about the adjustments they have to make in terms of increased frequency of bowel movements, adjustments to using the bathroom, especially at work and other social activities. People go from having 1 or 2 bowel movements pre-surgery to sometimes upward of 5 to 7 or many more than that, waking up at night. There is an adjustment period after surgery. It can last anywhere from a few months to more than a year. Your mileage may vary. But most people do report that they figure out a way to manage it, and they figure out a way to live with it. Despite this limitation, most people do find a way to work with their employers and feel like their employers have generally been supportive. And in this way, it's not all that different than living with something like inflammatory bowel disease or IBD, ulcerative colitis, or Crohn's, which is more common. People also talk about similar struggles after their surgeries. In research, participants typically report that their close friendships and their ability to continue to go to school and get an education has not been affected. They're able to succeed in the things that they want to succeed at, and that's good news. But around 20% of people do express high worries around, am I going to need additional surgeries? Am I going to get cancer? What about my other family members getting cancer? Most people feel like they have the support they need, but when you look at various studies, people who want professional support, so seeing a counselor, a social worker, a psychologist, someone like myself, they typically want to talk about those worries, the managing the uncertainty, in addition to coping with the illness in their other family members. Even if your health is fine, you may be a caretaker to somebody who's affected, a child or a parent or a sibling. Family planning is another concern, and of course, the yearly burden of having to go through cancer screening does bring up feelings for some people. In terms of FAP and relationships, I would be remiss to tell you that for young people that have new partners, it's hard for them to tell them about FAP. In fact, I've given talks about this before, not for FAP, but for people with IBD. How do I online date and tell people that I have this? And it is a challenge. People do figure it out in their own ways that works for them. People also report difficulty with first sexual encounters because they may have scarring, or they're concerned about what a new partner would think. And a minority do have some sexual side effects, usually around pain and orgasm. In the non-intimate realm, within families, people have mentioned a variety of reactions to being diagnosed with FAP. For some people, it brings their whole family closer in a way that they've never experienced before. For other people, especially for parents, some people do feel guilty and have to manage the guilt of passing on the gene to their child. Other people who had families that weren't great communicators to begin with, FAP is just another thing to not communicate about. And so a lot of what is going to happen in your family is dependent on the dynamic that pre-existed all of this, or just was laid down to begin with. But what you do see is that most people really do want open communication about FAP. They want the ability to be able to talk about these things. And for people that are living with FAP, parents or kids in particular, but other family members, are consistently a major source of social support. I'm going to talk a little bit about younger children. So there's a couple of studies that have focused on children either under the age of 18 or those who are under the age of 14, and looking at quality of life. And what we see is that quality of life is comparable to the general population in terms of physical and mental health, just overall. But younger kids do tend to have more incontinence and are more upset about the incontinence than somebody that's, let's say, in their 20s, for example. And despite the incontinence, very few are reporting restrictions at school, and only a minority have restrictions in sport activities. In the couple of studies that have been done on young kids, self-esteem and body image are generally in normal ranges. Of course, there's a minority that are struggling. Younger kids tend to worry more about cancer, interestingly. They are aware that they could develop cancer, and they worry more about it after colectomy. And they also worry more than older kids about the health of their FAP-affected parents. So in general, younger age is associated with more difficulties in adapting to life after surgery compared to older kids. But here's the thing. When we're looking at 14-year-olds, they're also dealing with the struggle of being an adolescent. So for young teens, I would say this is a period that's tumultuous without FAP. Dating, body image, acceptability to other people, hormonal shifts, moodiness. For those of you that have teenagers, you know exactly what I'm talking about. And putting FAP on top of that is just another drop in the bucket. Well, it's more than a drop. It's a significant additive to the bucket. And so if you've got a child at home that's recently been diagnosed with FAP and they're struggling, this might be a good time to take a look at some counseling for both you or for them alone. And we can talk about that during the question and answer period a bit. I did put together a slide in terms of talking to kids about FAP, kind of what are some general principles to follow. In general, younger children need simpler explanations. Don't think that a single conversation is going to be enough about this. I would consider having brief conversations to keep the lines of communication open. It's important to remind your child that they didn't do anything to cause their FAP, and they can't pass it on to other kids at school. They will have many different feelings: anger, grief, not talking. It's okay for them to have all those feelings, and it's important for you to validate them. It's also going to be useful to offer a realistic but hopeful assessment of the situation and focusing on the steps to treat FAP. So although their treatment might have difficult side effects, the treatment is meant to keep them healthy, and that's a good place to start, is focusing on health as opposed to the bowel changes, although being honest about the bowel changes. It's okay to say, I don't know, if you don't know the answers. And older kids in particular may want to take a more active role than younger children. And so if your older child wants to take that role and make some decisions, it's a good thing to let them have more self-efficacy, be more active. But they may also want you really involved, and it's going to require probably a couple of conversations about that. And finally, if you've got a unique situation and you're not exactly sure how to proceed, it is useful to talk to a counselor, either a genetic counselor or somebody in mental health, so you can figure out where your kid is at developmentally and what their unique needs are and how best to have these conversations. And I'll be taking questions later. Thank you.